Hi, everybody. This is Dr. Ed Park. Today, we're recording the second of our provider webinars on nasal therapy. To remind people, I went to Harvard undergraduate and for my residency in OBGYN at the Beth Israel Hospital. I went to Columbia for my MD and Master's in Public Health. And in 2016-17, I was consulting for a company. I was actually a wealthy man, wanted to start an anti-aging company. So he got me to come on board. And I brought on another collaborator who subsequently established an exosome company for cosmetic use as a result of that collaboration. In 2018, I was at the American Academy of Anti-Aging Medicine, and I heard a neurologist talk about his motorcycle accident only 6 weeks prior. And when I heard him, I was faced with a decision. Either he's lying about his healing, or there's something here. And I was leaning towards the latter because I knew about exosomes and that they're a natural way that we heal. So I injected my own knee, my rotator cuff, and my Achilles, and all three improved. So then over the years, I've been publishing dozens of blogs, webinars to educate people. And a couple of years ago, I created an online training course, which is 12 hours. And people can learn some of the techniques, some of the theories. They can download forms, and they can download even these forms that I'm creating. So I also do on-site training in California, New York, Florida, Texas, Hawaii, and Utah. And finally, I wrote and narrated a book last year called Exosomes, Songs of Healing, which explains to the layperson what exosomes are and how they work. So it's important to know size. Obviously, on the left, we have big stuff, humans, elephants, trees. What's interesting is that exosomes are right in the 100 nanometer range. So when your body makes them, above me directly, you'll see MVE, that's multivesicular endosome. So they've always known from observation with electron microscopy, even light microscopy, that there are these balls with balls in them, maybe up to a dozen or so balls in them. And because of the size constriction, how these come out of the Golgi apparatus, they're small, so small that they're invisible. Now, what do I mean? Abby's light limit is 200 to 250 nanometers. So anything below this size cannot be seen with optics. It's something to do with light. It's beyond my pay grade. But the point is, you can only see exosomes with electron microscopy. Nobody can actually see exosomes with the eye or any light microscopy. They are bespoke. That word changed from last week. Bespoke is, of course, a tailoring term. They're made specifically for a particular reason. And they're about 100 nanometers. They're a beach ball of a lipid bilayer. Inside, we have mRNA, microRNA, which is a subset of mRNA, and proteins. And this is the main way stem cells and all cells communicate. So they're in all bodily fluids, blood, urine. They're in milk secreted by cows. They're in plants as well. A discovery that is only about 16, 17 years old. Before that, nobody knew about them because they weren't looking for them. And the old model was that cells would secrete proteins, which is really probably not at all true. Sort of like dinosaurs making petroleum. So there are thousands of studies, tens of thousands really, that suggest cancer, organ failure, health, disease, different immune dysfunctions are related to exosomes. So we're just scratching the surface as to what it means. We'll skip over this. It's just showing again the exosomes being released from the multivesicular endosomes. And the important thing is on the left, we see a microscopy of electrons, not with light, and you can see what an exosome is. When you make them, you just don't have to do anything. It's very easy to make exosomes. The cells, especially certain types of stem cells like mesenchymal stem cells, when they're stressed, will secrete a bunch of exosomes. So what you do is size exclusion filtration. What does that mean? In this cartoon above me, you pass the fluid over. Anything that's small enough to fall through the grates, so to speak, will be saved. Everything above, thrown out. What's important to understand is that they don't do size inclusion. So we know from the studies from electron microscopy that if you're talking about a real exosome, which is a smaller type of extracellular vesicle, that they should be 70 to 130 nanometers roughly. So there's no reason why they couldn't do the same process for size inclusion. So a lot of the commercial manufacturers talk about how many particles they have. It's a little beyond the scope, but basically, if you want to count as many particles, you can go from billions to trillions just by changing the sensitivity. Because again, we're not seeing the exosomes, we're counting the Brownian motion of the particles. And a particle could be a tiny exomer, it could be a little fragment of something that's totally biologically irrelevant. So buyer beware when you're talking about counting exosomes. All right. So exosomes, to reiterate, are how we heal. Right now, you have billions, trillions, maybe quadrillions of exosomes floating around, keeping you healthy, keeping you not healthy. If you get a paper cut, stub your toe, or have a heart attack, your body will release orders of magnitude more exosomes to heal. How do they do that? We think that they bind with other cells and they get released into the cytoplasm and they do their thing with their mRNA, their proteins. Nobody's ever going to know. Larger extracellular vesicles, I just learned this year when I went to the ISEV, International Society for Extracellular Vesicles, larger ones that are way, 10 times, 20 times bigger can hold mitochondria. So like a good neighbor, you can borrow a cup of sugar. It turns out that in the retina, retinal pigment epithelial cells secrete large extracellular vesicles that contain mitochondria to share with each other because the eye is the most metabolically active cell type in the body, apparently. We also have tendons. A gentleman shared his study where he made organoids or mini organs of tendons. And when they get exhausted mechanically, they can actually share mitochondria as well. Who knew? So the way that they work, if we think about the history of regenerative medicine, there's PRP, which they take your blood, they spin it, they inject it, it causes inflammation, pain. They say, don't take Tylenol, don't take Motrin. And then that brings in stem cells, we presume, and the stem cells, either locally or that are brought in, will secrete exosomes that will cause this cascade of remarkable healing. They do this with stem cell proliferation, stem cell dedifferentiation, which we'll get into, growing the extracellular matrix, changing the T cell phenotype from Th1, which is antibody producing and inflammatory, to Th2, which is regenerative. And the M2 macrophages come up as opposed to the M1 inflammatory ones. And there's also new vessel growth. Reminder that mRNA is a force multiplier, like a clutch, allowing you to switch to a higher gear. One mRNA can be read, as we see from this electron microscopy above, many times. So that's not one protein. That's making many, many copies of the protein. This process of the ribosomes writing down the one single transcript is shown there. So it's kind of like a player piano roll that can be played over and over and over again, and even simultaneously. So that's important to understand. Here's a mashup of a relatively recent summary. It's 2,600 procedures, over 5 years, over 500 patients, 1,000 visits. And number one, because there's two nostrils, is the nasal treatment, which we will go into today. Some of the side effects I've seen are above. I have seen non-phlebitic vein swelling, non-painful, non-clotting twice, once in my mom. No anaphylaxis. It's very anti-inflammatory, and it's very psychotropic for a lot of reasons, which we'll go into. Reminder to those that don't know, this is not FDA approved. So every patient that has a treatment has to read and sign this. There's no guarantee that I will improve. This is not FDA approved, does not represent standard of care, and is something that the person voluntarily requests. We see a slide from the ISEV this year. Someone mashed up all the current ongoing trials of clinical human-derived MSC exosomes and a couple other types. And there are some in Europe, and there are many in the US. And someday, if we do get approval, it might open the door for off-label use. People ask, well, how can you do something that's not FDA approved? The left is one reason we can. Doctors have to use their ethics code of conduct to do what's best for the patient. When we talk about epidural steroids, which is standard of care, which is reimbursed, it's never been FDA approved for that indication. And epidural steroids are actually dangerous. With a 14-year black box warning, it can cause death, paralysis, stroke, and lots of bad things. And yet people do that. Will you be called to the carpet for that? Probably not. Is it helping patients? Questionable. All right, this is the part of the webinar that you're most interested in. Why even do nasal shots? Now, I did stem cell training, I'm going to say 7 years ago, 8 years ago. And at that time, we learned the technique from our teacher, how to inject the nose. So that's a technique that I was aware of. When I started doing exosomes on myself, on my knee, on my meniscus and Achilles, I decided to say, well, this could help people. Why don't I try it in my nose? And so I did that in the spring of 2019. And the strange thing, I'll never forget it, was after an hour, I felt very excited, like the feeling right before the top of a big roller coaster. And then in 2 hours, I got goosebumps. So, well, that's strange. And then since then, and you'll just have to believe me on this, I've been able to give myself goosebumps at will. So, what is that? If you do a deep dive into goosebumps, especially the voluntary goosebump production, there's two articles. They're not very insightful. What is known is that some small percentage of people can give themselves goosebumps, and they always have been able to. What I didn't see in the literature was the acquisition of that phenomenon, except in the case of like heroin withdrawal. Some people had brain trauma. But as far as like, for my case, I can make myself have goosebumps anytime I want. It's not pleasurable, it's not painful, it's just a voluntary thing now. And what is that? I venture to say that the majority of people have had goosebumps in their lives. Like, for example, if I look at these twins from the starting, I'm getting it now. The French have a word for this. It's a specific word. It's, I believe, frisson. And that means when you hear music or other art, or I think we've all had someone say something very profound to us, and then you'll say, "Ooh, I just got goosebumps." So it's a human phenomenon. It's part of our system, just like sweating and burping and laughing, I guess. I can tell you that before the nasal shot, I only got goosebumps from doing my first sun salutation. That's yoga. I would get them. And then when I bought this gong in the showroom, it also gave me goosebumps. Who knows why? So I wake up in the morning, I gong a little bit, maybe a couple seconds, and it gives me goosebumps. What does that mean? Nobody knows. When we talk about the Hindu religion, I guess it's not even a religion, philosophy, science, they talk about chakras, and the chakras are ordered here: red, orange, yellow, green, blue, indigo, violet, from low to high energy. So we will talk a little bit about that. But I want to dedicate this webinar to my good friend Gentry, who will collect a lot of information. And he told me, oh, you know what that is? When you do your sun salutation, that means your chakras are aligned. I don't know if that's true. I don't know what that means. Aligned, working together, who knows? But it's slightly different from ASMR. In the last 7 years, people have gotten interested in these little whispering videos where they make noises and the hair will stand up on their back, the back of their head, sort of brain orgasm. It's unclear to me what the subset is, but there's a related phenomenon, but ASMR is something kind of similar. So that's how it started. Here's how it's going. 4 weeks ago, I was treating some employees of the company that I use, and they had an open bottle. And there was a young lady who wanted to try the nasal shot, but was very scared. So I decided, well, maybe I'll try it on myself. I injected my own nose in front of like 7 or 8 people. And so she had the courage to do it. The reason I didn't do it was because, like a feature in an app that you purchase, it was probably there, but it got unlocked. So, what does it mean that I can still do it almost 6 years later? It means that it permanently changed my brain. And for someone whose father died of brain cancer, I didn't want to change my brain too much too fast. Who knows what would come about? But I decided to go ahead and do it. I mean, I have to eat my own cooking. It's my most popular procedure. So I did triple the strength on each side, 4.2 billion. And I can tell you that for the first 2 days, I had a lot of hypersomnia. It's not that I was drowsy or psychomotor retarded. I just slept a lot. Maybe my glymphatic system was cleaning out or moving some furniture. Maybe it's due to vagal activation. Slept a lot, incredibly vivid dreaming. And then since the last 4 weeks, I've had great mood stabilization. I've gotten things off a multi-year to-do list. I have more increased resilience, I find. So things that are annoying to me or threatening, they'll bother me, but not for long. You know, a couple seconds and then just move on. And my neuroplasticity, I believe, has improved. At the time, I was learning Japanese, Portuguese, which was fine and fun, but it got a little boring. So I started adding languages. And now I've added Chinese, Russian, Hindi, Arabic, Swedish, German, and Italian. So, for example, the Hindi you see on the top left is ka, and then to the right is ka, and then bottom left ga, and to the bottom right ga, which all sound the same to me. So I almost quit, but it's nevertheless funny. Also, my friend Michelle, who's a doctor, we play this word game at least twice a day. She's won 361 times. I've only won 53. She's much better than I. And yet I beat her twice in a row for the first time, which was cool. So just a reminder for those that don't know, Gentry said, well, when you have goosebumps, your chakras are working together, meaning here are the chakras, all seven. The heart is in the middle. and that represents love or feeling connectedness. But there's other ways of being connected. Below that is the sacral plexus, which is center of power or social belonging. Below that is sexuality, pleasure, creation. And then at the base is safety. So if you are, people say you're in your root chakra, that means that you feel threatened. Above that is the throat for expression. Then the third eye, which is for understanding, clarity. And then consciousness is the top above our body. It's the crown chakra for connection to source intelligence. Okay, enough of the woo-woo. So let's go to how is this even working? I went to Integrative Medicine for Mental Health 2-3 weeks ago in DC, and I saw a great slide, which I couldn't find. It said the olfactory nerves are the elevator to the brain. So that's shown above me. There's so many nerves perforating, and it's a good way to get into the brain, at least through the olfactory bulb. How do we know this is true? Well, we'll reference the work of Daniel Offen, who's a professor in Israel. And so what he did in this study, you can look it up, 2018. There's another great study in 2020. He injected IV. On the right, you see barely any penetration into the brain, whereas intranasal inhaled got into the brain relatively efficiently. He had 3 types of staining for the pathology. You could see in the middle of the screen. In the green is staining for neurons. If you stain for these gold particles, you will see that they accumulate in the neurons, which is good if that's where we want our payload. And then to the bottom left, we see that if somebody is given a stroke, a mouse is given a stroke, then they will concentrate in that area of inflammation. What does this mean? It means even if you give it IV, if there's areas of inflammation, a couple things are happening, and that has to do with the blood-brain barrier. So let's talk about that. As an advanced practice audience, you know that there's a blood-brain barrier, which means that if you put something in an artery, even the carotid artery, is going to go up into the brain, and there's going to be a barrier because the junctions in the small capillaries are tight. So it's just going to come out the other end in the venous circulation. Now, when I went to ICEV, they posed the question, do exosomes get into the brain through the blood-brain barrier? And it was 50-50. So even the most advanced scientists disagree. And why is that? Because the blood-brain barrier is dynamic. It's not a barrier per se. So when I went to the conference this year for A4M Peds, a lot of people talked about how the blood-brain barrier opens up when? Vaccination. All these things like whatever it is, thimerosal or mercury, all these adjuncts that are supposed to cause immune irritation, they can cause opening of the blood-brain barrier. When you get a brain infection, the blood-brain barrier opens. Why is that? Who knows? Maybe to get antibody-producing lymphocytes in there. Even though the local police, the microglia, should be taking care of it, they need help. So the blood-brain barrier opens and closes. We have tricks to open it. And so if we see the middle bullet point, unencumbered by data, if you just think about logically, probably the highest concentration of delivery to the central nervous system would be intrathecal because the CSF is bathing the various structures of the brain. And then after that, injected nasal. Why? Because if you are inhaling nebulized nasal and it has to get absorbed through the mucosa into that space, I guess it would be a higher rate of delivery if you just inject it with a tiny 32 gauge needle, as we will see. So then after that, nebulized nasal, this Daniel Offen study shows that they go to the brain. And then if a person has brain inflammation, or you give them mannitol, which is something that they've always done to try and open up the blood-brain barrier, you get a higher concentration. And last, without inflammation, the IV is probably the poorest penetration because of said blood-brain barrier. All right, another study by Daniel Offen in Israel. He gold-labeled exosomes, and he showed that they were collected primarily in structures that are affected by Alzheimer's, like the olfactory bulb. Of course, that's the first stop into the entry. But the prefrontal cortex, where we reason, striatum, hippocampus, and cerebellum. This wonderful slide he created on the left shows mechanisms that we talked about earlier, angiogenesis or new vessels. But then there are also 3 others, neuroprotection, neuromodulation, and neurogenesis. Fancy words which you can parse out yourself. And he theorizes that this will shut down inflammation, maybe aid in appropriate apoptosis, combat ischemia, maybe combat misfolded protein aggregates. Of course, we know that plays a role in dementia, deal with hemorrhagic accidents, abnormal electrical activity, and demyelination. Now, even deeper into the science rabbit hole are these things called microRNA. So microRNA are 21 to 23 base pair antisense mRNAs. mRNA, as you know, is single-stranded. So if you have a mRNA in your cell and you don't want to express that, you express microRNA. So that 21 base pair finds that suitable matching strand of expressive messenger RNA and gums it up. So that messenger RNA is no longer expressed. Why do we talk about this? Because here are a couple of candidates of what could be notes in the songs of healing when it talks to brain and nerve regeneration. MIR 133 is known to regrow neurites. What are neurites? Neurites are the appendages, axons, the dendrites of cells. Amazing. And then MIR 34A and 140 implicated in getting you to stop the inhibition of remyelination, right? Why myelinate if you already have myelin? So this is tonically expressed in a lot of these neural stem cells or nerve type cells. So by blocking the dedifferentiation inhibitors, you get remyelination. Why do we know this is true? Because some people who are much smarter and specialized have done this model, for example. Neural crest differentiation above us, bunch of mRNAs, MIR 140 is showing up there. We see MIR 38, 124. So there are certain things that are deployed when you're making a neural tube, in other words, or when you're regenerating a nerve that should not be expressed. But then when these switches, these inhibitors of dedifferentiation get in there, they can cause new nerve growth. All right, let's dial it back to the funky sort of speculative realm. So when I was asking myself, what is human consciousness? I came up with this paragraph or this sentence. Let me read it to you and you can think about it later. So human consciousness is interoceptive, meaning you're monitoring your interior state, even the thinking state. Sensate, meaning you're taking in sensory input. And apperceptive, meaning you're applying meaning to the sensory input. It's dynamic, it's in motion, like a melody. It's a qual. Qualia is plural for qual. So what is a qual? A qual is a snapshot of how your brain is functioning anatomically, electrically, biochemically. So it's like if you had a deck of cards with Steamboat Willie driving the steamboat, it's one of those cards. So these dynamic states are under the influence of anatomy, physiology, metabolism, level of arousal, level of fear, inflammation, and they mostly work via recursive procedural memory schema. Schemata, if you want to be a Latin scholar. So what the heck does that mean? So in the middle top, the reticular activation system is our level of alertness. It's what wakes us up every 90 minutes while we sleep. It's the do not die thing in your brainstem, like an automatic sprinkler. So that's your level of arousal. And that maybe that was triggered after 1 hour of exosome use. What is the amygdala? Well, on the bottom left, we see when you're afraid, nothing else matters. I got to live. So that's your root chakra. People who can extend that into their identity, into their politics, they are demented. So they can't use their higher cortex. So if you are in a high emotional state, everything equals everything bad, and your tribe is going to die and people are going to be genocided, then you're not thinking straight. So you're in a high emotion, low cognitive prefrontal state. Schemata are shown to my left. Person schemata, we could call that your ego. You have things you learned growing up in the society from your parents or whatever. This is the software that you use to explain who I am, what I usually do. Social schema, you're going to be different at a party with friends versus a business meeting. These are another software programming, how to proceed. Self schema, how I view myself. I'm a future doctor. I hate broccoli. These are just software things that you can change. So you get the picture. There are things that we learn and identify with, and they remain semi-conscious. And these guide our physical experience of consciousness, which is a dynamic process. And so what's interesting, Gentry, my friend, used to drink a lot. He has, a little bit of ADHD. He's a very brilliant guy, learned a lot about a lot of esoteric things. And I remember I did a nasal shot on him a couple of years ago. and he stopped drinking for 6 weeks. And it was the strangest thing. And I just filed that away. I'm like, well, that must be that addiction is maybe a form of inflammation. And to this day, he says, well, I don't really feel a compulsion to drink. I like it. It's very egocentric, meaning it suits me and who I think I am. But it reminded me of this funny quote by David Lee Roth. He said, I used to have a drug problem. Now I make enough money. But I'm bummed. And then Leonard Cohen, our great poet, sang in his song, That Don't Make It Junk, I fought against the bottle, but I had to do it drunk. And of course, people talk about addiction. It's a very morally laden thing, but we have to understand that addiction is a way of treating self-soothing, some kind of self-induced maintaining trauma circuit. And so we should have empathy for those who are addicted. A lot of people are addicted to their politics, their thoughts, their religion, whatever. All right, let's go to the fun part of the talk, which is prosopagnosia. We're going to go through about 5 or 6 vignettes of people who had neurological changes that were quite profound. So when I first started doing exosomes in the very first year, I needed dry ice. And I met a woman in my neighborhood at the time, Newport Beach, who sells dry ice. And so she said, oh, by the way, have you ever heard of prosopagnosia? I said, no, I haven't. She said, well, it's people can't recognize faces. I go, what do you mean you can't recognize faces? She said, well, my daughter will bring her friend around and I can't remember her friend's name. And then if we go to PTA night, I don't know who my daughter's friend's parents are. And it's embarrassing. It's bad. I asked her, well, why is that? She said, well, she was 30 years old. She was pregnant. It just appeared suddenly. What does that sound like? To me, it sounds like brain damage. So being pregnant triggered this localized lesion in her head. She's fine with other patterns. So anyway, you can watch this video at ExoWeb18. If it's ExoWeb, means it's a webinar. If it's ExoBlog, it's a blog. So tiny URL, oh, that's misspelled. If you go to tinyurl, it'll be a scammer site. I misspelled that. It's tinyurl.com. So we gave her IV nasal shot, and indeed, within a couple of weeks, she said, oh my God, I went to PTA. I can recognize people now. I know them. I go to softball game. I recognize people. That is crazy, and it still remains much improved from what it was. So again, an N of 1, as we would derisively say, but nevertheless a phenomenon like my goosebumps that can't be ignored. Sidebar, autoimmunity can occur during pregnancy. Pregnancy is a very dangerous time. I say that as a former OBGYN. And if you look at the facial rejuvenation patient that I had, 11 kids and not even of a particularly pronatal religion. During her 7th pregnancy with her daughter, she developed MS. Towards the end, she could not even walk unassisted. And she cured it with a very unorthodox jugular venous stent. But that happened. And then recently at IMMH, we ran into a patient, doctor who I went to train in Sacramento. And her 40-year-old mom also during pregnancy developed nausea. And that seems okay. People get nauseated during pregnancy. But it's 40 years without any associated symptoms. No vomiting, no triggers, never goes away. So again, what does that sound like? Brain damage. There are 2 regions you can look up that cause nausea. And after her treatment with intraspinal, she actually does not have to take Zofran every day, which is amazing. All right, traumatic brain injury. A month and a half, maybe 2 months ago, I was at the Rad Fest and I ran into my good friend Olga. And Olga is a medical doctor. And in May of this year, or I think it was, she had a unwitnessed loss of consciousness. She had fallen backwards, hit her head, and was lying there for God knows how long. And since then, she had terrible brain fog, agitation, word finding difficulties, and was depressed as a result. In talking to her, she couldn't really finish sentences. Her speech was faltering, as we would expect with a complex traumatic brain injury. So she wanted to economize. She only bought the smallest unit, which is $350 wholesale. And so I said, yeah, we'll do it for you, no problem. We did it. Well, half a cc on each side, which you could argue is 700 million nasal exosomes. And her situation seemed to improve. She sent me this next morning. On the left is her before, 16% harmonization of the brain. We see a lot of slow wave activity, delta, theta. This is all below 8 cycles per second. So she was like, even in a waking state, her brain was kind of groggy, like in deep sleep. And then the next morning, it was up to 36, which you see the addition of alpha, which is conscious thought, and then beta, a little faster rates. So that seemed to harmonize. And also her inflammation as measured by a heart rate variability went down 40% according to her in a day. So again, typo, tiny URL, not RUL, exoblog number 3. Check it out. One of my very first patients was a friend in Hawaii who also did a banana peel cartoon fall and had military neck. So her military neck from spasm, whiplash went away, as did her word finding difficulty from the shot in the nose. I write about a case of long COVID in the book, but this is a case that one of my good friends, golf buddies, I've been treating his knee for many years. His wife had had a problem. She said that it feels like there are ants crawling on my brain and there's a spike going through a part of it. And welcome to the world of AI photo generation. Here's what it came up with. So at the time, she was 53, and her story begins in March of 2020 when she had a 3-month bout of atypical COVID. So what does that mean? She lost her sense of smell, but then it triggered it persisted for over a year, low energy, poor focus, depressed mood, and again, a feeling of ants crawling and a spike through her brain. So in her case, we did not do nasal because, as I told you, I think the highest dose is through intrathecal. We did an intrathecal injection, and it slowly started to get better. Perhaps it changed her brain wiring, her brain inflammation, regenerated some neurons. No idea, but now she does not have these sensations, and her cognition is improved. But the reason she's in this lecture is because we did give her a nasal shot one time, and that's when it all sort of clicked for me, because she had had galactorrhea from a microadenoma, about a 1 centimeter tumor in her pituitary, anterior, of course, and she had transsphenoidal surgery. What does that mean? It means that the base of the skull was perforated by surgical instruments to get at her pituitary. So this probably was what allowed the COVID to do such a number on her brain, because that normally sort of porous barrier between the sinus, the mucosa, all that, the nerves, and the brain was weak. So the COVID invaded. And then I know this because, we gave her a nasal shot, and unlike anybody I've ever seen, she's like right away, she felt it in her brain. It took me an hour, I told you, to feel that excitement. She felt it right away. So that tells me that her barrier is probably compromised. And what did it feel like? It's hard to explain. It wasn't like when people say they feel good, they just feel calm. Some people can feel a little activated, but it's not like, something on the order of like, caffeine stimulation or cocaine or anything like that. It just people feel good and calm and relaxed generally. There are some people who are very, very intense, like leaders. I know a couple of people that have platforms where they influence thousands of people at once in a live audience. Those people tend to get very excited, which is interesting by exosomes. So anyway, if you want to read more, go to my book, Exosomes, Songs of Healing. We talk about long COVID. And again, every slide should have this, that human MSC exosomes are not FDA approved to treat any disease. Here the spelling is restored tinyurl.com exoblog 44. Now the case, this was 2 months ago, month and a half. I was meeting my friend. She's a 55-year-old OBGYN. I met her like, I'm going to say 13, 14 years ago. She was leading a module on one of the physician training sessions and was the first person to ever buy me dinner of the female persuasion, because she and her friend were like, oh, we loved your lecture. Come, we'll buy you dinner. I didn't order the lobster. I probably had a salad with the protein. But anyway, a couple of years ago, she had sudden onset of eye pain. There's 3 branches of the trigeminal. V1 is around the eye, controls lacrimation, all this good stuff. Hurt like hell intermittently. And it happened during the time of harmonic scalpel surgery, which is 55.5 kilohertz. So her assistant stepped on the pedal, boom, eye pain, come and goes. And for a year, she had suffered. She was taking Tegretol to zone out, GABA to zone out, Botox, Imitrex, none of it really helped. It was pretty dull pain and then intermittently very sharp and very sympathetic activating. So if you ever talk to people like with hyperacusis or in this condition, trigeminal neuralgia, the pain is so intense that it puts them into a shock state, like they're freaking out. And that's really the worst part of it, is the trauma. So anyway, intermittently was 10 out of 10. She was really thinking of self-harming, but she has children. And anyway, it went away for whatever reason. I don't know. If you think about it, her brain surgeon doctor said, oh, how is he going to get into the Meckel's cave? The Meckel's cave is something behind and below the eyes where the trigeminal nerve trifurcates. You know, the people talk a lot of fancy stuff, but basically we just injected a nerve and it diffused up to the stellate ganglia, whatever. All I know is that it can sometimes help with these cranial nerve pathologies. If you want to learn more, another case of a umpire on Staten Island I treated for traumatic brain injury, that's Exoblog 40. So trigeminal neuralgia is so rewarding because it's one of the most painful things. And to be able to take that away is such a mitzvah or a blessing because people are suffering a lot. For anybody that doesn't know, they taught us there are three worst pains in the world are bowel obstruction, corneal abrasion, and rotten eye tooth. And so you see that 2 out of 3 of those are already in the trigeminal system. All right, stroke rehab. I've done about 11 patients. I've never had anyone not have a positive change. And you can read more about that or watch the video ExoWeb 12. Just 2 weeks ago, 2.5, we had a lady come down from Napa vacationing, and she was treated. So she's a 57-year-old woman. She had a witnessed failure to stand. She was rocking her grandchild very peacefully and then couldn't stand. So they rushed her to the hospital, which was just blocks away. And luckily, she got clot busting. TNK is the new TPA, I guess, Tenec Tep Lace. Sounds very Central American. And anyway, they busted the clot in her carotid, and I think they actually basket extracted it as well. So the upshot of which, she didn't have any gray matter lesions, thank God. But if you look at her MR, it shows that the white matter, is damaged. It's hyperechoic, or it's hyper signal, we should say. And so she came. It was 6 weeks after her, I guess, glorified stroke slash transient ischemic attack. And she got nasal, she got IV, she got intrathecal. So the full Monty, every method we can to get into her brain. And indeed, I spoke with them 3 days ago, and they said her brain fog, her mood is better. Energy is much better. That was the main complaint she had. Even her gait while transitioning and moving is more steady. So tiny URL ExoWeb 12. The 12th webinar will talk about stroke recovery. Getting towards the end, we have an incredibly brave nurse practitioner who helped me create the course. She was in attendance for most of the things. Unfortunately, her father passed today of liver complications. So our thoughts and prayers to her. She has a profoundly autistic 10-year-old who is now an 11-year-old who's not as autistic. So they go to Disney World every other week. He's able to cut with scissors. And she showed me a grid of objective measurements of autistic behaviors, all of which improved. So because it helped her son, she wanted to offer it to patients. And now she sees about 30 patients a month. And her claim is that she gets about 65% positive response, maybe about 15 to 20% worsening in terms of their stimming, which we're trying to figure out, is that due to detoxification, PANS Panda Association, maybe human herpes activation. But her protocol is under 5 and under. She gives 1.4 billion nasal. And again, this is one brand, not all the brands. 1.4 billion IV. Older, bigger, 2.8 or twice as much nasal, and 1.4 billion IV. And this was just based on her understanding of the literature. Daniel Offen's work with these autistic mice. It's really interesting. And so her intuition, her need to find something was the mother invention there. So they have these mice that act autistically. They isolate, they don't interact with the other mice. They're whatever, preoccupied, self-soothing. And it's fun to watch and see those videos as well. She will use intranasal with this thing called a dart. It looks like a dart. You put it on a lure lock, you gently press, and it nebulizes mechanically. In the middle, we see some text messages from a doctor who a month ago tried it on herself, which I always recommend. If you're going to do something to people, you should try it on yourself. So she tried it on this profoundly autistic child, and the mom texted, "This is from his speech therapist. He's so present. There's a different energy to him. His self-regulation is amazing." And she answered, "It's the stem cell product." She replied, "He said some words for the first time." In other words, initiating speech is very odd for autistic kids. And then the week after that, the other text, "He's been having good school days, which is new, and his ability to self-regulate has mastered or has increased." So again, human MSC exomes are not FDA approved to treat autism or any other disease. But as I did learn at Elisa Song's A4M Peds meeting, there's a lot of inflammation that goes on with autistic kids. It's probably permissive, as in the case of the lady with the spike in the ants. When their blood-brain barrier is open from gut and neuroinflammation from perhaps vaccines, then a lot of bad stuff can happen. And when you reduce the inflammation, perhaps that's mitigating and modulating the autism. What are the risks from nasal therapy? Well, mainly somnolence. I mean, you're not going to be operating heavy machinery, but it's not like a psychomotor retardation, like being drunk or slow. It's just you feel sleepy and you want to take a nap, you take a nap, you feel amazing. So it's maybe a higher order of repair programming kicking in. We see that they can be immunosuppressive. So what does that mean? If somebody has an active viral, fungal, parasitic infection, bacterial infection, I would not use them. We know that they're immunosuppressive because they go from Th1 to Th2, so you're not making antibodies. And so beware in that case. And the rate of, cold sore activation, maybe 1 in 25. The majority of people do report decreased sinusitis, environmental allergens, but again, be cautious if you have a known unresolved infection. Epistaxis can happen. I don't know if this is so great, they taught us that in school, but these nose plugs are indeed a lifesaver. So, you're going to get some nose bleeding, but if somebody has some kind of strange vasculature or recent surgery or infection, they can be more. These nasal tampons are genius, and they're very helpful. I would also caution that in the elderly who've had prolonged hypertension, their arteries are stiff and maybe not so bright. So if you relax them too much with high vagal tone, this may lower their blood perfusion of their brain, leading to watershed issues. So if somebody is on multiple antihypertensives, they will need to check their blood pressure. They'll tell you, "I feel dizzy." And this is because the arteries can't relax. They're just stiff and tight. So beware of that. It happened with my mom just 2 months ago. She was like low blood pressure, feeling dizzy, had to stop her meds, take caffeine. So here's the nasal protocol that course members can download. It's just a one-page cheat sheet, and they're all like this. Shows the indications, contraindications, supplies, disclaimer at the bottom, how to set up, how to examine the patient, and each step-by-step of the process. We'll run through this real quick, and I'll show you a video for those people that are visual learners after the presentation. So basically, the indications, I think anybody can probably use a nasal shot, just helps to upgrade. I was scared because I didn't want to upgrade. My brain was fast enough, but I realized that a lot of my brain power is being used to worry about the future and perseverate on the past. So it's put me in a more resilient state. People with addictions, I could argue, stroke, TBI, traumatic brain injury, autoimmune stuff involving the head. And in the wake of spike protein neuroinflammation, a lot of people have these sort of problems. Some of them are getting shunted into MS, ALS, Parkinson's, but the rate of increased neurologic problems is alarming. Contraindications include recent nasal surgery, untreated acute infection. You don't really need much. You need a vibrator, and I'll show you why in the video. You need sterile gloves, exosomes, and something to melt them. A big needle and 2 small syringes if you're doing both sides. You have tiny, tiny needles, 1/4 inch, 32 gauge, 2 of them. Nasal tampons, sterile cotton-tipped applicators, individually wrapped, and 2% viscous lidocaine, which is just a gel the dentist uses to prep you before they put the needle in. So let's go through the process. You're going to open your sterile gloves, put all your supplies on there sterilely. Okay, so then you take the tampons, put them non-sterilely on the side of the sterile field with a small dollop of viscous lidocaine. As with any procedure, there is the non-sterile and then the sterile. Once you put on the sterile gloves, it's sacrosanct. So the non-sterile part of it is opening the gloves, putting all the things onto the sterile field, putting a dollop of 2% viscous lidocaine, and cleaning the vibrator, showing it to the patient how to turn it on and off, and then melting the exosomes. Give them a couple of Kleenexes, gently cleanse the nares with betadine, maybe 3 times each side. You'll pop the top, clean it with alcohol, hand it to the patient. Put on your sterile gloves, and then put your large needle on your empty syringe. Have them point the vial towards your sternum. You seat the needle, they push the bottle as a safety measure. You suck it up gently, and you put your exosomes there. You do it twice. If you're doing 2 cc's, 1 cc each side is the max. So they've got the cleaned out nose, they've got their Kleenex, they got their vibrator. Have them put the vibrator on the head, and then they really, in most cases, are sitting up with their head slightly extended. You're standing above them because that's comfortable. Always important to be comfortable when doing procedures. And then have them turn on the vibrator, apply it to the ipsilateral side. And it's very important you imagine where you're going. You're not going straight back. You're not going towards the middle. You're going towards the side. You're not going up the nostril. You're not going down. You're not going into the skin. You're going lateral. So you're going about 30 degrees posterior and 30 degrees lateral. So you got to kind of stand to the side, touch their nose bridge, and then just visualize it, because you don't want to be futzing around there with the needle. It just scares people. So you take your 32 gauge air-free syringe, and they're vibrating along, and you hold their nose, and then you just pop through. You can only go to quarter inch. Quarter inch is not deep. You'll feel bone. If you somehow have the patient move or you move and you're spilling, that's bad. So you ask them, is it spilling? The answer should be no. If it's blebbing the skin, you're in the wrong direction. You're anterior, you're superficial. So you're going to pop through right kind of beneath the lowest turbinate, the bony part, if you put your finger in your nose. And you're just going to slowly inject a cc. Half a cc, they love you much more. It doesn't hurt. So each time you inject about 0.1, you just press the nose bridge. It's vibrating. They barely feel a thing. And so you do this on both sides. You put the tampon in on each side, check for bleeding a minute or 2 later, and that's it. That's all you got to do. All right, let's do the video demonstrations. I'll stop sharing, and so you can see what we're talking about. This is first video I want to show is piloerection. You can
This is
see
what
me
voluntary
just thinking.
piloerection
Anytime I
looks
want,
like.
I can make my hair stand on end. Fabulous. What does that mean? I don't know. Secondly, I want to share this video. I'm not sure the audio will work, but we can try. I guess you're not hearing the audio. So this is just me talking. I'm pressing the nose bridge. I'm injecting about 0.1 cc every time.
2, 1.
Oh, you are hearing the audio.
Okay, we pop through and we feel bone. So we're under the mucosa. And just kind of go slowly off pressing the nose bridge. You doing okay? Mm-hmm. You're doing great. Breathe. The faster you go, the more it hurts. So I'm going to go slow. It's not trickling, right? Mm-mm. Good. So we're in the right space. Yeah, I did this 2-3 days ago. I felt so calm and good. You all right? Mm-hmm. Great. Done. So then we'll put a tampon just to stop and check for bleeding.
Okay, so that might be something different in the final edit. Let's go ahead and go back to the slides, and then we're almost done. So above me is a picture of the lady from Texas who came in with her partner 3 weeks ago. And again, less brain fog, more energy, less gait disturbances. I thought that was a really cute picture. If you want to learn more about sleep architecture, pick up this middle book, The Telomere Miracle, which I wrote for Hay House in 2018-ish. And so it really takes a deep dive into sleep architecture. The more I think about it, the more I think that people need sleep for different reasons. The first 2 cycles, physical repair, growth hormone surge, and structural memory. And the next 2 cycles, 90-minute cycles, are procedural memory, meaning storytelling, REM sleep, And there's some great stuff in there about how to influence how you sleep, how to hack sleeping, how to get better sleep. The times when I wake up after 8 hours, my body, my mind is rested, and I just feel lazy, like a Sunday morning, and I just sleep 2 more hours, I'll have intense dreams, and perhaps that's a different part of our chakra system that is resting. If you have any questions, thank you for attending. Please type them into the Q&A. Dr. Joe asks, are you injecting about 10 times into each nair? I guess so. Just, micro movements of your thumb. You're watching the syringe, but then you're not. You're focused on the patient. Be calming. Be like, oh, you're doing fine. Just breathe, just breathe. And before you know it, it's over. If you're only doing half a cc, it's practically painless, but you don't want to do the whole syringe at once because pain is a function of the volume, of course. Someone asks, have you seen memory improve or cognitive clarity with nasal injections, particularly those in older populations that have not had a traumatic brain injury? Yeah, I would say so. My mom is currently, 87. She's had about a dozen nasal injections. And I'd say she's pretty sharp. You can't really get one over on her. Is she 100%? No, she's not. But if you're asking about like Alzheimer's, dementia, it's probably too little too late. I mean, that's like a burned down building already. At the A4MPs conference, I did hear talk about galactin-3 antibody binding, which is something that binds some of the structures that make the tangles in the brain. And at least anecdotally, they're touting it as very good for dementia. But it's many things. It's not ever one thing, right? It's your underlying protoplasm, your genetics, your metabolism, the inflammation, the trauma, the lack of vasculature. Everything is falling apart. So this is just one way to mitigate using biohacking, if you will. And so, yeah, the answer is yes. People tend to have better cognitive clarity, better memory, word finding. But again, it's all relative, isn't it? Any other questions about nasal treatment, neurological treatment, even intrathecal? I'm not sure we're even going to do an intrathecal. Okay, Dr. Joe asks the question, you keep on saying billions, but isn't it trillions? So no, it's probably not. The people who study this and make good estimates, like the scientists, the companies, it's probably billions. What they're putting as a marketing thing is trillions of particles. So remember that exosomes are particles, but particles are not exosomes. So there are smaller exomeres, like 30 nanometers. There's debris, there's junk. If you take sterile water out of a glass ball and put it in one of these counting machines, you'll get trillions of particles, even though there's nothing there. So you can call your thing whatever you want. Are there exosomes? Are there particles? Are they in the trillions? Yes, 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 yes. But do you have trillions of exosomes? Probably not. So even the people who do this, they can't count the exosomes. So they'll say, well, I know I have 10 million cells in culture and I drain it off every 3 days. And the amount of exosomes in there is, we'll call it, some X number of billion or trillion but no, generally speaking, 10 to the 9, for those who like scientific notation, is the number. In your body, it's probably 10 to the 12. There's probably trillions of exosomes or maybe even quadrillions of exosomes, but no. People have been using these numbers very dishonestly. And so they will say, I have twice as many exosomes with half the cost, but really they're selling particles because nobody can count an exosome. Anita asks, how often would you do a nasal injection? Well, you don't have to do it at all, but if you just do want a boost in your mood, I mean, arguably, if it's just for maintenance every 3 months, again, it took me 5.5 years to repeat mine just because of that weird thing that happened. So, there's no right or wrong. But again, if I'm treating some serious thing like a traumatic brain injury, stroke, you want the highest dose possible. I'll probably do nasal plus intrathecal, but you can argue for intrathecal alone. We can't do brand names like a CME, but yeah, I didn't even know that I was doing triple. I was trying to reassure the young lady. She was scared, but I ended up doing, you know, 6 years ago, it was 1 and 1. This time it was what, 4.2 billion, 4.2 billion. But I think my brain has gotten sharper. My, resilience, my reactivity, all that has gotten better. And one thing I realized when I was taking telomerase activators, the synchronicities, the good luck, people get lucky when they're in a flow state. So what is a flow state? Flow state is Mikhail Shilashkashvili, a psychiatrist who talked about, the violinist, like Gloria, the lady with the trigeminal, is a concert violinist. This week she's playing in a doctor's orchestra in Buffalo. And so when you're playing the violin, it's very hard, but you have a lot of skill. So if you do something that's hard and you have a lot of competency, you're in a flow state. Whereas if you do something that you have no ability to do, it's frustrating, it's scary, and it's easy and boring, then that's not a flow state. But I would argue that just being alive, thinking, being human is difficult, and we have a lot of mastery to it. So when you get into a flow state as a person, you get lucky. You meet people on planes, you meet people waiting in line at the bakery. Everyone has that synchronicity of things that can help you that you have in common. But most of the time, we're so locked into the neuroses of getting through our day that we're in the lower chakras. So I do think that with telomerase activators, we've seen people go into flow state, but also me, 1 month status post triple strength nasal injection, I feel like I'm more in a flow state too. And that's when I decided to create these webinars. So I do think it's generally helpful. And I was afraid that more thinking would engender more anxiety and depression, but actually it's helping me be resilient and shake that stuff off. So I like it. Okay, good questions. Next week, we'll be talking about knee treatments. And speaking of which, how is Anita? Let's see if Anita wants to talk to us. Well, you don't have to. Gentry, my man. Hey, we were just talking about you. Speak of the devil. Let's see if Gentry wants to address the good people of Gotham. Are you there, buddy?
I just wanted to attest to the fact that you were speaking about flow states earlier. And yeah, I feel like I've been in sort of a gradually increasing flow state, getting projects done, focusing, and so forth. I think my treatment was over a year ago.
That was weird.
Listening
Like,
and
did
making.
you consciously want to stop drinking after we gave you the shot, or was it just something that you
Well,
just...
it seemed like it just came out of the blue, I guess. It's like, it was first of all kind of a financial decision and motivated by a lot of things, but I didn't even have the idea to stop drinking until after. And I was like, I called myself a professional drinker, not an alcoholic or anything. So, but I just gradually said, I'm going to stop this. And then I did. And there was no side effects, no craving for alcohol or anything. And I feel like that now. Now I do have an occasional drink, but it's not like an accessory, or it's not something that I need to have.
Right. It's not a fix.
But
It's just a part of your
yeah,
lifestyle. Yeah.
yeah,
I
yeah.
love it.
Yeah,
I
where
love it.
yeah, it's my whole attitude toward it is different now. But along with that, I know that alcohol depletes part of the brain. I think what is it, the
Oh.
frontal lobe and all that. And so I was naturally drawn to things that help rebuild that.
Mm.
And that's kind of you're talking about synchronicity and stuff like that. And so yeah, I was just naturally drawn to taking more lion's mane and other herbs and things that were helpful for the brain functioning. And
Well, like we've
and
always been taught, a mind is a terrible thing. Yeah.
yeah, it's very clever. Yeah,
Could be,
very clever.
it could be to waste, to use, to not waste, but it is incredible. But yeah, I was
Yeah.
talking to Evan, my son, about how even his experience of his own consciousness transformed 3 years ago. And part of that might have been due to a nasal exosome shot, I remember. So who knows? I think
Yeah.
probably the sweet
Yeah.
spot is for people with inflammation, compulsive behaviors, addiction, mood disorders. I think it really is promising.
Yeah, I feel so as well, because I've experienced a lot of these things, and the catalyst was for me, I think, was that first treatment, and then I just noticed a change, and looking back on my life, how things are changing.
Yeah, I mean, you're getting luckier in some ways, So
Yeah,
I just think
yeah.
that, yeah, I was really scared to do it, but I'm glad I did because I think I got a little bit of an upgrade. So did I
Yeah,
tell
well,
you I
thank you.
got the Dave Asprey podcast today? Speaking of getting lucky. So we're
Wow.
manifesting that. I'll be in Austin in 2 weeks doing his podcast. So that'll be amazing.
Oh, awesome. Awesome. Well, thank you.
All
Thank
right.
you.
All
That's
right.
cool.
Thanks, Jesse. Talk later. So
Mhm.
we have Anita responded. Feels a little better, but it's still early. I think that the real test will be in 3 weeks, see where she's at. She had torn up knees, 66-year-old with bilateral osteoarthritis. Okay, speaking of knees, next week we'll be doing knees, and I hope you can join us. If you ever miss these webinars, they are recorded and posted to YouTube. Make sure that you have drpark@rechargebiomedical.com in your known contacts. Most of the time, emails go to spam otherwise. All right, thanks everybody. We'll see you next week. Bye-bye.